Over the first 2 or so years of a child's life, they're building 1,000 synapses a minute.
There are so many different social responsibilities.
Right.
How does that affect child?
So the worst thing you can do to a developing brain is deprive it of experience. I went in the direction of getting a PhD in developmental psychology, and then I retrained in neuroscience.
So can we safely say that the early years of life are special in terms of the brain plasticity they offer? How do you see children growing up in this world of AI? For parents whose child is already on the spectrum, how do they support this child?
The children who are diagnosed the youngest and get early intervention at an earlier age have much better outcomes. The prevalence of autism has gone up dramatically.
3 things that you would want to tell urban parents in relation to childhood development that they should know. Welcome to the first episode of From Birth to Bloom. I'm so excited that you're here, and our first guest is Dr. Charles Nelson. Dr. Nelson is a renowned psychologist and a neuroscientist and has shaped our understanding of childhood development. He has studied institutionalized children in Romania. He has studied disadvantaged communities in Bangladesh, the impact of the Zika virus in Puerto Rico, all to guide us on understanding how early childhood experiences shape the young brain. Today, Dr. Nelson holds prestigious roles at Harvard Medical School, the Boston Children's Hospital, and the Harvard T.H. Chan School of Public Health, and he's continuing his pioneering work in the space of childhood development. It's such an honor to have Dr. Nelson as the first guest because his pioneering research has helped our understanding of childhood development today. Join me as we delve deep into this understanding to understand how these different experiences, and especially in early life, shape childhood development later on as well. Thank you so much for your time, Dr. Nelson. And kind of to start off the conversation, I really wanted to know what brought you to the field of children? Why did you initially choose pediatrics, but then also kind of focused your interest into that early childhood space?
When I was in university, I knew I was interested in kids. Mostly I was interested in the process of development. And I started volunteering in the summers to work with children they were then called learning disabled children. But at the same time, I was interested in the brain. And there really was no way to merge developmental neuroscience with child development. So the advice I got was I went in the direction of getting a PhD in developmental psychology, and then I retrained in neuroscience. And then I sort of married the two fields. I think that to me, there's nothing more interesting than the study of development. I had actually considered astronomy at one point. I did 2 years of astronomy, couldn't do math. But the same issue, what gives rise to the universe and what gives rise to us? So development was particularly interesting. And then almost by accident, I wound up in a lab studying babies, and I just thought babies were the most interesting creatures ever. And I just became very enamored with how do you study something that is changing so rapidly, and how do you study their brain, and how do you marry it to a study of behavior?
Absolutely. And I couldn't agree more, because it's this almost snapshot into their life when so much development is happening, which never happens ever again.
That's right.
You have done extensive research on early brain development. How do we now understand how this early period of life affects brain development, but also just development in general for a child?
Sure. So the first thing to know is how rapid brain development is in those early years. So the brain formally forms at about the 3rd week after conception, but it's really the 2nd and 3rd trimesters where brain is really getting put together. But most of that development is under genetic control. We know the environment can impact it. Women who use substances like alcohol or drugs is an example of that. But after birth, most of brain development is, in a sense, regulated by experience. And in fact, to put this in context, over the first 2 or so years of a child's life, they're building 1,000 synapses a minute. So brain development is incredibly rapid. The peak seems to be is the first 1,000 or so days. And we think of that as a sensitive period. And we say that because given how rapid brain development is, it puts the brain in a position of taking advantage of the environment. But as we start to prune back synapses or connections among brain cells, the brain starts to lose some of its plasticity. And that's, as a result of that, is that as we move beyond the age of 3, things have settled down. Our visual system is developed, our language system is developed. This is not to say what happens later isn't very important, which it is. It's just that building the foundation is what occurs in those early years.
Correct. So knowing what we know now about even brain plasticity, we do know that some amount of brain plasticity does take place later in life as well. So can we safely say that the early years of life are special in terms of the brain plasticity they offer just simply because of how much use they make of the environment?
Right. So that's a very good question. They're special in some ways and not special in others. For building sensory systems, they're special. If you want to learn how to see or hear or learn language, all of those things happen in those early years. The same goes for social and emotional development. We form our earliest attachments in those early years. And there's extensive work to suggest that if you're deprived of vision or hearing or attachment figures in the first 2 or 3 years, that will have a long-term impact the rest of your life. However, there's another form of plasticity that persists throughout the lifespan. Learning and memory is a good example of that. A personal example is my mother is 98, almost 98 and a half. She still drives. She uses a GPS in her car. She uses an iPad and she uses a computer. Now, she'll probably call me in the next 20 minutes to say something's not working. But the fact is she's learned to do these things at that age. So there is that kind of plasticity, but you'll never learn to see better or to hear better. You might learn to listen better, but not to hear better.
I really like the comparison you made to attachment figures, and you compared it to something as essential as your senses like vision or hearing.
Right.
And you have studied institutionalized children a lot.
Sure.
And we kind of have read a lot about understanding how that lack of attachment affects child development.
Right.
Could you touch upon that just a little bit? And especially today, how does that translate into a world today where parents are juggling work? There are so many different social responsibilities.
Right.
How does that affect child development?
Okay, that's a great question. Let me start by broadening that question. Why is neglect so bad for the brain? And the reason is that in those early years, the brain is sort of in a wait state. It's basically saying, okay, send me the instructions and I'll build myself. So brain construction is dependent on experience. So the worst thing you can do to a developing brain is deprive it of experience. Hubel and Wiesel earned a Nobel Prize for demonstrating what happens when you deprive an eye or both eyes of visual experience. We know from experience with children who are born deaf, unless they have a cochlear implant early on, they'll probably always have hearing and then language problems. So we know neglect is a big deal because the brain is waiting for these instructions to come along. A good example of that is in caregiving. So we are sometime between really 6 and 24 months is the sort of sensitive period for forming an attachment. And we usually do that to a primary caregiver, but we have a hierarchy of caregivers. So it could be mom, and it could be dad, and it could be auntie, and it could be somebody else, right? But there's always one person at the top. We have, there's clear evidence, of course, that when that doesn't occur, when there is no inadequate caregiving, children suffer. Now, to speak to the second part of your question, I've often been asked, well, what about two parents who are both physicians and they have really long hours and they drop their kid off at daycare at 7 a.m. and they pick them up at 7 p.m. Isn't that like being brought up in an institution or an orphanage? And the answer is no. There's consistent caregiving. The child goes home every day to the same parents. The parents have made a huge psychological investment in the children. And the way I think of this is that there's a threshold. We need just enough to form these relationships and to facilitate healthy development. But beyond that amount, it might be a little bit tweaking here and there, but it's not hugely consequential. So to reassure parents, they may be busy, they have a lot going on in their lives, but if they're invested in their child and invested in child rearing, their child's going to probably be just fine.
I think that's going to be extremely reassuring for a lot of parents to know. Because I can imagine that's constantly a battle you have to earn in this economy. There is no way that it's becoming more and more difficult for a parent to stay back home. I was brought up in a house where my mom was constantly around, but I don't think that's possible in the economy today.
Yeah, I agree. I think that the days of having a single-headed household, well, in the sense that there's a couple, but one stays at home and one goes to work, I think that's pretty much gone. Yeah. Now, what you said is if there's an issue that you raise that's important, which is there are many single-headed households. Usually it's a mom who's responsible for everything about their child. That's much harder, right? Because if she's working and she has to find good daycare and afford good daycare, then the stresses on the mom are much more considerable. And then I'm worried a little bit more. It can be done, and it's done routinely, but it's just much harder on the moms to do that.
Absolutely. Absolutely. I have read a lot of your research, and one of the widest pieces of research has been about toxic stress.
Right.
When do we classify stress as toxic? Because I can imagine that there is some amount of stress which we all face, which is natural. And sometimes it is good to experience some kind of stress because it teaches you a lot.
Right.
But when is that tipping point where we start classifying it as toxic, and when is it harmful?
So that's a very good question. I think that there are ways in which stress has gotten a bad name. We all need stress exposure, particularly early in life. It's only by being exposed to stressors that we learn how to manage stress. So the National Scientific Council on the Developing Child, probably almost 20 years ago, came out with a gradient. They talked about positive stressors, tolerable stressors, and toxic stress. And what really distinguishes those three is the presence or absence of a buffering relationship. So a young child being left with the babysitter for the first time, going to school for the first time, going to the doctor for the first time, those are stressful experiences, but there's a caregiver around who cares about the child, and it buffers that. Even intolerable stress, maybe a child has to go to the hospital overnight or for a week because they have a medical problem, but the parent can see them every day, and there's good nursing staff and the like. Toxic stress is when we would recognize that the stressor is bad, and it's coupled with the lack of a buffering relationship.
Okay.
So, of course, the obvious examples would be abuse, right?
Okay.
Because often the person doing the abuse is the very person who should be the buffering relationship, and it leaves the child without a buffering relationship and the experience of stress. So, if you think of that as a gradient, what makes it toxic is the lack of a buffering relationship, coupled possibly with the severity of the stressor itself, like, again, physical abuse or sexual abuse or emotional abuse.
Correct. And how do we understand this toxic stress to amount later in life? Are there behavioral changes? Are there more mental health troubles? How can we compare this to what happens later in life?
So I'll try to keep this short. Many years ago, the Adverse Childhood Experiences Study was launched in Southern California by the Kaiser Permanente Healthcare System. And what they did is they simply queried middle-aged adults for one of 10 adverse experiences they had when they were little. Their parents get divorced, was a parent incarcerated, and there were a number of things. And they found, and they had repeatedly reported, this association between the higher your ACE score, the more adverse experiences you endorsed, the more likely you were to develop psychological or physical health ailments across the lifespan. So they linked the number of adverse experiences in the first few years of life to lifelong physical and mental health. So that was the initial observation. I think the field has advanced since then to realize it's more complicated than simply the number of adverse life events. So, for example, a 4-year-old could be sexually abused, and another 4-year-old could have their parents get divorced. They both have an ACE score of 1, but we'd never think that they're equivalent, right? So we now have to factor in the severity of the adversity or the nature of the adversity, the timing, is it start early or late, and its chronicity, how long does it persist? And those are the factors that influence things. But we know if the stresses are severe, there's a lack of a buffering relationship, and they persist for the first years of life, the likelihood that the child will develop cardiovascular disease or diabetes or asthma or psychological problems is greater.
Correct. And again, it's so interesting that somewhere that mental kind of stress or toxic stress that we're calling is so kind of directly correlated with physical health outcomes as well. It kind of, again, ties in that point of your mental health is related to your physical health in a lot of different ways.
Precisely. Exactly.
Another arm of your work is related to autism. Mm-hmm. And I think one of the first questions that I have is that for parents whose child is already on the spectrum, how did they support this child? How did they ensure that they're supporting this child's unique developmental path, which they can't replicate from what they've studied about a more neurotypical child?
Right. I'm glad you raised that question, because it's that question that in part has led to the discussion about neurodiversity. Rather than be disorder-centric, we should be thinking these children are neurodiverse. They're not typically developing. They're developing differently. Now, I'm going to qualify that in a minute. I think that a few things about autism first. We know that the children who are diagnosed the youngest and get early intervention at an earlier age have much better outcomes. But that often requires the ability to diagnose early. In the United States, the average age of diagnosis is still 4. And it's probably a little bit older in other parts of the world. And in low-income countries, it's probably even more severe. Like when I work in Bangladesh, it's older than that.
Awesome.
Second, I think that there needs to be access to services. So there's an ethical issue. Do you diagnose if there's no referral system in place for getting that child's help? The evidence is clear that the sooner the earlier in life a child gets early intervention, the better their outcome. But it often needs to be intensive. They need a minimum of, say, 20 hours a week. And now bring it back to your question. The family needs to be part of this whole thing. It's not, sometimes it's school-based or center-based, but it needs to be brought into the home. There are a couple of things for parents to be aware of, which I suspect anyone listening to this and who has a child with autism will resonate with this. It's stressful to have a child who's neurodivergent or who has a diagnosis like autism. It requires resources. So for a family living on the margins of financial security, that can be another stressor because how are they going to afford good services? In some parts of the world, it's paid for by insurance. In other parts, it's not. I think that for children who are more severely impacted by autism, for example, they may not have any language, is particularly difficult because parents communicate with their children through language. So now they have to learn a whole different system of how do you read your child's facial emotions, for example, or tone of voice? How do you deal with children who have disruptive behavior? The two most common comorbidities with autism are ADHD and anxiety. Those are huge issues for families to struggle with. So the more supports they have, the better.
Yeah, absolutely. And another one is that the early indicators of autism, like you currently mentioned, that the earlier it's diagnosed, the better it is in terms of the outcomes it has.
Right.
What do you and your team look for as these early indicators of autism?
So there are a number of classic signs that are often observed by a year. One is a child who doesn't turn when you call their name, turn and look at you. And the second is either the lack of eye contact or the lack of being interested in faces. Now, these things alone are not necessarily predictive. It just turns out that many children who are diagnosed with autism and retrospectively were kids who didn't turn when their name was called and didn't have an interest in faces, but they're early signs. I think that part of the definition of autism would be restrictive and repetitive behaviors. So when you see a child being completely obsessed with an object over a social event, that's a concern. So that's the restricted interest. The repetitive behaviors could be hand flapping or rocking are the two most common. Spinning is another one. So what you look for is the combination of these things. It's not any one of them. All young children, when they get really excited or really upset, might shake and flap and rock. Yeah. They might stutter a little bit. They might cry and not want to look at you. But it's the totality that we should be looking for.
Correct. It's not like one isolated symptom. Again, your work is quite global in the aspects that you've covered. There's Romania, there's Bangladesh, there is Puerto Rico, there's Brazil. Between all of these, what have you found which is common to children who A, have had adverse life events or B, have been institutionalized? I
think one common thread is the role neglect can play. So we know that in many parts of the world, but we'll use the United States as an example, 80% of the cases reported to Child Protective Services involve neglect. So the work that we've done in Romania isn't limited to Romania. It's a model system for understanding why neglect is bad for child development. So that's one powerful take-home message. I think a second is that we want to think we can isolate individual forms of adversity because then we have a target for an intervention. If a child is being maltreated, we do something about that. If the child is exposed to intimate partner violence, we can try to intervene there. But the reality is that children are usually exposed to multiple forms of adversity. And we're still trying to model how those things interact with one another. So an example would be a child growing up in a poor home in an unsafe neighborhood with a single parent who's very stressed, is not in a good daycare center, and food scarcity is an issue. All of those things combine to gang up on that child and increase the likelihood that they're going to have some developmental issues up the road. So we have to consider the totality of the child's environment.
Absolutely. And the sad part is that each one of these usually exists together rather than in isolation.
Exactly.
Kind of switching gears a little bit to what's currently going on. There are so many advances that neuroscience is making, the imaging techniques are making. Is there anything that you're particularly excited by? And a second part of that question is that how do you see children growing up in this world with the advent of AI? Do you foresee any kind of struggles or challenges that they might have?
So let me start with the first one. I think I'm very excited about some technology changes. I think that for someone like me who has spent most of my career recording the brain's electrical activity, EEG, there are now ways to do this that are very portable. You can do it in the child's home. I'm assisting a colleague of mine here in a project in rural Ethiopia, where we go into villages and we can put these little caps on the child's head and record their brain activity. And at Boston Children's Hospital, there's a very, very large primary care clinic. We have a portable EEG system there. When a child comes in for their well child visit, we grab them for 5 minutes, we record their brain activity for 5 minutes, and they go on to their pediatrician's visit. This demonstrates that things that used to once be confined to a laboratory can now be brought to families and brought to clinics. So that's exciting. I think a second is that with advances in computer science, we're now able to mine the data we've been collecting for deeper signals. Think of an example in radio astronomy or particle physics where historically those little tiny signals were invisible and we might have thought of them as noise. But now we have ways to extract the signal from the background noise. And I think we're learning much more about the brain. And in that context, I think, it's a very small field right now, but this field of brain-machine interface or neural prosthetics historically was very invasive. It was for patients who were having neurosurgery, and they could communicate through brain activity. But I don't think it'll be long before we can do that just by placing sensors on top of the head. It'll take advances both on the electrical engineering side and the computer science side. Now, in terms of AI, I think people sometimes conflate machine learning and artificial intelligence. Many people, like my lab, uses machine learning extensively for signal processing. That's very different than AI. So since we're doing a podcast, Google has a new platform where that I just recently tried. I uploaded one journal article of mine, and I uploaded a brief bio of mine, 15 sentences. And in 10 minutes, it spit out a 5-minute podcast narrated by 2 AI figures, a man and a woman, that was unbelievably accurate and compelling. So there are going to be a lot of tremendous uses of AI. Another example, and I have to be transparent about this, I'm on the board of a company called Kuro AI that is trying to revolutionize pediatric healthcare using artificial intelligence. And one part of it is that in the United States, a family may have to wait 1.5 years to get an appointment with a specialist to see if their child has autism. Yeah. This might be a way of doing this much earlier. Getting services is a problem. So this platform might be a way to provide services. So those are all the good parts about AI. But of course, there are the scary parts. And we all know what those scary parts are. So I think this is something we, on the one hand, need to lean into, but on the other hand, keep our seatbelts on.
Yeah. No, absolutely. Absolutely. And I kind of think a little bit about how it would be for kids as they're growing up with AI. How do things change for them? And of course, we do know like the basic stuff, like they have access to a lot more information. Perhaps they're not going to do their homework in the same way that it used to be done previously. But how would it mean for them to grow up knowing that there is this extremely strong support system almost to any challenge that they might face?
Well, think of the way we use AI. So I'll give you one example. In my lab, ChatGPT is used extensively to assist in writing computer code, right? So that's one way. Another way is to simplify things. So if you have to write an email or a paper that is very jargony, these things can be very useful tools in simplifying it. On the other hand, we worry. So I'm teaching a first-year student seminar at Harvard right now, and on my syllabus, I say, the options were, you can't use AI, you can use AI. I have the middle option, which is, if you use it, I need to know about it.
Correct.
And no different than documenting a paper that you read.
Absolutely.
So I think for children growing up, much the way I have Alexa devices throughout my house, or I use Siri to help me, children are just going to grow up in this very new world where they have ways of learning things and doing things for them that my generation certainly didn't have and your generation didn't have. But will it, by taking shortcuts like that, mean that we don't have to learn things? So an example is I have terrible spatial ability, so I'm always GPS dependent. People have said, well, by using a GPS, you'll never learn your way around. But my response is, I never was going to learn my way around. And without a GPS, I'm always lost. So we have to think of the technology as a tool that we can harness in a good way, recognizing, again, its potential evils.
Absolutely. I'm taking a class on the gut-brain axis right now, and we're reading a lot about how the gut affects the brain. And of course, autism is a huge part of the conversation we're having. And what you mentioned with regards to your first study, that there is a huge rise in autism that is seen right now.
Yeah.
I can imagine part of it is, of course, due to the fact that we have better imaging, we have better diagnostic criteria. So perhaps kids in my generation who weren't getting picked up now might get picked up because of that increase. But also, I wonder if it's something to do with the world we live in.
So I take that as a question. So what I'm worried about is the same thing. We know the prevalence of autism has gone up dramatically. It's now in the United States, the CDC figures are like 1 in 36 or something like that. And 10 years ago, it was probably 1 in a few hundred. A lot of that can be accounted for by earlier diagnosis and better diagnosis and things like that. But there's still this other residual that we can't explain.
Yeah.
It can't be genetics. Genes don't change that fast. So that leaves it to be an epigenetic phenomenon driven by the environment, which begs the question of what is it in the environment? So when I let my guard down, and if someone says, well, what are you particularly worried about? It's how busy we are and our use of phones and tablets. They don't cause autism. But if you have a genetic vulnerability and you're not your child is deprived of dyadic social interactions, I am a little worried that could be one of the points of entry into having a child who winds up going in the direction of autism. There's no evidence to support this at all. And I said this with reluctance because there's no evidence to support it. But if you look at what has changed in the world in the last decade or two, that's it. It's this combination of we're so busy.
Yeah.
We know, I've traveled all the time. When was the last time you saw someone on a plane without headphones on, plugged into working or watching the movie? 20 years ago, you just sit on a plane and read a book, right? So parents today are crazy busy, particularly if they both are working. So we have the busyness factor and we have the distraction factor. And the embedded part of the distraction factor is that by spending so much time not interacting with our kids, that's a concern. But we're paging through things so rapidly that we just go on to the next topic, and it's leading to this sort of phenomenon that resembles ADHD because things are happening so quickly. So right now, 1 week from today is the U.S. election. I can't think of anyone that I know of who is not obsessively checking the latest news online to see what will contribute to the outcome of the election. So you're constantly refreshing your page. I get maybe 30 or 40 emails an hour. So how do we keep up with that volume of email and constantly check the New York Times website to see who's ahead in the polls and get some work done?
Yeah.
So
absolutely. Do you think one factor also contributing to, again, the autism spectrum and developmental theory, that whole spectrum of childhood development, is environmental toxins. In my class, we have been reading a little bit about how maternal inflammation plays its role in childhood development. And of course, maternal inflammation is one thing which we've studied because it's easy to study.
Yeah.
But I can imagine that even paternal factors come into play. When both of these are coupled together, and like you rightly mentioned, there has to be some kind of epigenetic programming in two neurotypical parents who have come together and then have had a child who's not neurotypical. Perhaps there has been a change. Would you instinctively say that this could be due to all of this inflammation that we now know exists in a lot of people?
Yeah, I completely agree. We're, again, right at the leading edge of where the science is. So an example would be, with the rise of obesity and maternal obesity, we have this greater risk of inflammation, and those inflammatory factors can impact fetal development. So the number of women who are pregnant who have BMIs above 30, for example, which meets the criteria for obese, is increasing at an alarming rate. So there's that factor. Then there's the inflammation derived from poor diets, right? So there's that factor as well. So we talked about the microbiome, but I'm glad you raised this issue because I think inflammation is going to prove to be a big contributor to poor health outcomes, more so than the way we used to think. It's like, you know, your white blood cell is elevated or something like that.
Yeah.
I think we're now thinking of the myriad of factors in the environment that can lead to maybe even low levels of inflammation, and that can cascade into arthritis and heart disease.
Absolutely. Absolutely. And as my last question, because most of the listeners of this podcast are going to be urban parents, what are perhaps like 3 things that you would want to tell urban parents in relation to childhood development that they should know, either if they already have a child or if they're planning on having a child soon?
One is to spend time with your child, but don't stress over it. Don't think that every time, every moment they have available should be spent with their child. Children need to learn to play and to be independent, but they really need to invest in their child. And if you find yourself hanging out with your kid, hang out with your kid. Don't be staring at your phone or the TV. There's a lot of talk about screen time, and there's growing evidence that more screen time is bad for kids, but we've known that since the 70s and 80s when we just had television. It's not that screens cause a problem. It's all the things that kids aren't doing when they're sitting in front of a screen, like play, being outside. I think another thing is to pay attention to diet. For little kids, this is always hard for families. There are kids who are picky eaters. Kids with autism may be in an extreme. They might only eat things that are white, for example. But many kids can be very picky, and that drives parents nuts because they want them to have a good diet. But then there's the other group of parents who are poor and can't provide good food. Mm-hmm. So what do? So diet, I think, is another factor we have to think about, not just for growth, but also for anti-inflammatory properties.
Good.
I think another is, given how hectic our lives have become, I see more couples having a stressful relationship. And I know one thing I tell my son and daughter-in-law in front of my grandson, it's, if they're going to argue, take it out of the room. Never do that in front of their kid. Kids are like sponges. They pick up on tone of voice. They may not even understand the words, but they know something bad is going on. So I encourage families that if they're going to have a dispute, do it out of earshot of their child. So that's a third bit of advice.
Absolutely. Thank you so much for your time.
My pleasure.
This is so informative for me as well, simply because I'm just so curious about this field.
Good.
And thank you so much for your time.
My pleasure.
Thank you. Thank you so much.
Thank you so much for tuning into the first episode of From Birth to Bloom. It was such an honor to have Dr. Nelson to be the first guest. He's a pioneer in the field of childhood development and understanding early life experiences. So to hear about different tips coming from the researcher himself helps us understand what science-backed information looks like and how we can implement it in our daily parenting goals. I hope you enjoyed this episode. Feel free to interact with me in the comments down below in case you need any more information, have more questions. I would love to chat with you. Thank you.